Aphorism number 102. In the course of writing down the symptoms of several cases of this kind, the sketch of the disease picture becomes ever more and more complete, not more spun out and verbose, but more significant, more characteristic, and including more of the peculiarities of this collective disease. On the one hand, the general symptoms, for example, loss of appetite, sleeplessness, etc., become precisely defined as to their peculiarities, and on the other, the more marked and special symptoms, which are peculiar to but few diseases and of rarer occurrence, at least in the same combination, become prominent and constitute what is characteristic of this malady. All those affected with the disease prevailing at a given time have certainly contracted it from one and the same source, and hence are suffering from the same disease. But the whole extent of such an epidemic disease and the totality of its symptoms, the knowledge whereof which is essential for enabling us to choose the most suitable homeopathic remedy for this array of symptoms, is obtained by a complete survey of the morbid picture, cannot be learned from one single patient, but is only to be perfectly deduced, abstracted, and ascertained from the sufferings of several patients of different constitutions. In this aphorism, Dr. Henneman has given idea about how to know the totality of symptoms. While writing down the symptoms of several cases of this kind, the portrait of the disease picture becomes more and more complete always. It should not be more lengthy and more expressed in the words, but it should be more significant, more characteristics, and including more of the peculiarities of the collective disease. On the one hand, the general symptoms, for example, loss of appetite, sleeplessness, become precisely defined as to their peculiarities, and on the other hand, the more marked and special symptoms, which are peculiar but to few disease and rarely occur, but specific combination of the symptoms become prominent and constitute the characteristic nature of the disease. All the patients who are affected with the disease prevailing at the same time have surely contracted, exposed it from one and the same source, and so they are suffering from the same disease. But the knowledge of whole extent of the disease and its totality of symptom is essential for enabling us to choose the most suitable homeopathic remedy for this group of symptoms, which is obtained by complete survey of the morbid picture. This can't be learned from the single patient, but it is only to be perfectly abstracted and ascertained from the sufferings of the several patients of different constitutions. Footnote number 89. The physician who has already in the first cases been able to choose a remedy approximately to the homeopathic specific will from the subsequent cases be enabled either to verify the suitableness of the medicine chosen or to discover a more appropriate, the most appropriate homeopathic remedy.